about the UCSF Population Health Data Initiative, which is a collective of us who have been engaged in this work. We now call ourselves in phase 2.0 of the data initiative. And I have a slide towards the end with the names to acknowledge all the people who are currently involved in this phase 2.0. We've made huge strides over the past few years and want to share where we're at with everybody because we've got some great resources available to accelerate research and make it easier for people to do really high quality research with complex data sets. So what we are trying to do is support efforts to provide data and other research resources for population health, health equity, and health services research at UCSF. So what does that mean? We have three main areas of activity. One is cataloging data resources so that you can find the types of data that you want. The second area is around facilitating data access and licensing so that you can get all the proper approvals in place to access the data that you want to use. And then enhancing computational resources so you have enough horsepower and memory and computing space to do the work that you want to do. So I'll talk about each of these. We'll start with the cataloging piece. So what kinds of data can you use for health services research? There are several different types of data that are commonly used to study health systems and health services. One of the most common sources is electronic health records. They are very well known to people. If you're a clinician or even a patient, you've probably seen an electronic health record or seen a clinician interact with one. This is the full health record of what is going on with the patient. And as such, they are incredibly rich data and can answer a lot of research questions, but they are not without limitations. Two of the limitations that I find in some of my own research is that it can be really difficult to get data from multiple sites and settings. So if you have a patient who maybe was seen at UCSF, but they have a community provider in Fremont, you may not be able to access records about anything that happened to that person in Fremont. And that might be really important to your understanding the full trajectory of care for that individual. So that kind of lack of operability across sites can be a problem. And the data often does not include information about the cost of care, the charges that were put forward to the insurance company or to the patient, or insurance plan details. So if you're interested in research related to healthcare spending, you also have a big limitation with the EHR data in this regard. So a way to get around those problems is to look at insurance claims data. So this is basically the billing and payment data, and it comes from multiple sources. You can get data from the Centers for Medicare and Medicaid Services of the US federal government, which has information on the Medicare and the Medicaid claims. You can also get Medicaid claims from individual states, since Medicaid is operated by states. You can also get commercial or private insurance claims data from various vendors. I'll talk more about all of these in a few minutes. And these data include everything that would be involved in an insurance bill. And it often also has information about the enrollee's insurance plan, how that plan's designed, what kinds of co-payments might have been made, how much was charged to the insurance company and paid by them versus how much the patient paid. So depending on the study you're doing, these data have advantages for being able to cover people over time, as long as they're within the same health insurance, and to be able to understand more about the cost of care to them, which can be useful for a lot of research. Another data source that really goes up another level of abstraction from the claims data is administrative or encounter data. And this administrative discharge or encounter data compiles summaries of all hospital discharges, emergency department visits, and/or ambulatory surgery visits. These data sets are generally collected by states, and then the US Agency for Healthcare Research and Policy has a centralized mechanism to purchase them from multiple states through what they call the state inpatient database, There's a state ambulatory surgery database and a state emergency department database. That same agency, ARC, also has a nationwide inpatient sample, and I believe they also have an emergency department sample. And that is a nationally representative sample of discharges or ED encounters that you could use to study broad patterns nationally. Whereas the state inpatient databases generally can be merged with hospital level data. You can identify the individual hospitals, so you could merge the data onto the American Hospital Association data or other data sources. So these administrative data just have very abstracted information about every discharge that might have occurred from a hospital. They have the advantage of being pretty universal, and they go back a long way in time. California's data goes back to 1982 and can be merged with very, very rich hospital data about staffing, spending, patient volumes, and even numbers of residents and fellows. Those data go all the way back to 1976 in California. So if you really want to do a long-term longitudinal study, those data are great. You also can do research with surveys of patients or care providers. There are a number of different national and state surveys that can be used to look at patients and their experiences in more depth, or clinicians and what clinicians or clinical settings report about the care they provide. And so I've listed just a few here on this slide, and there are a lot more available to you. So how do you find out what we have at UCSF or learn about other data sources? Well, this is where we have a data guide. This guide lists more than 100 population health resources from global, national, and local data purveyors, many of which were included in an older registry here at UCSF that was called CELDAC. So if you've ever wondered what happened to CELDAC and you've been around long enough to have heard of that, it is now all in the data guide. So this is just a screenshot of the population health and health services research section of the data guide. So this is the updated page, and this covers all kinds of data, including administrative, demographic, epidemiological, surveys, and so on. The data guide identifies if the data are free or if they require a fee. There's an icon to indicate if there's a cost. And if we have a copy of the data, there is a link to get more information about it from a CTSI consultation. So you use the data guide, you found the perfect data set. Now, how do you get it? So what we are trying to do through the Population Health Data Initiative is to provide for you a centralized source for finding those data sets, but then also a simplified process for getting access to the data, UCSF site licenses for commonly used data sets, and efforts to standardize the data use agreements. So to start with that data access solution, I'll talk a little bit more about two large data sets that you can get at low cost or free. One is CMS Medicare claims data. So these are data that are insurance claims for fee-for-service Medicare. There's a small fee to access the data, and that is a reuse application fee that gets paid directly to CMS. And then there is and that's $2,000, whereas normally to buy the data for a single year might cost you $20,000 or $30,000. So it's a huge cost savings to reuse the data that somebody else already purchased. We also have a computing and storage setup and a programmer available to extract the data. The programmer's time is recharged at $132 an hour in 10-hour blocks. And then the computing and premium storage environment is about $140 a month for 12 months. So really kind of a bargain for data storage. You also can access for free the MarketScan research claims data. This used to be called Truven MarketScan, and then more recently IBM MarketScan. IBM actually sold this data set to a private equity firm, so I think the IBM is going to get dropped off of that any day now. But the data is in a license with UCSF. It is free to access the data if it is an intramurally funded study or an unfunded study. And then if you are doing a study with extramural funding, like you have a grant to pay for the research, there is a fee that basically is linked to the publication that you do. So there is a fee for the data, and that fee is heavily discounted from what it would cost you to buy the data on your own. So you can get the data for free, for example, with a RAP grant, if you're doing preliminary data in preparation for a grant proposal. And then when you get your R01, the cost of purchasing or accessing the data is much lower than it would be on your own. And this is available to all researchers at UCSF. So to go into this a little bit more, how are claims data derived? Well, basically medical records, the electronic health records, are converted into codes that are used to categorize diagnoses and procedures. ICD-10 codes are the diagnostic codes, and then CPT codes are the procedural codes. And then from these, there are diagnosis-related groups that are derived, and these are all used for billing. So the billing is basically the claim made to the provider for payment by the health system or the hospital, the physician, the physical therapist, whoever it is that's making the request for payment. The data that we have on site is a 20% cohort of Medicare data from 2009 through 2018. And this includes multiple different files: inpatient data, outpatient data, general informations about some of the providers, the pharmacy data, and so on. So there's actually a lot. I mean, the data are pretty complex, and there's a lot of rich information that you can get. We also have partnered with the School of Medicine Dean's Office Technology Services Group, or SOMTech, to basically curate these data sets across UCSF that are available and make them available to you on reuse. Now, we also, so through this reuse program, these data use agreements are available, and we have staff support from this wonderful person, Victoria So, who is able to help complete the reuse agreement for you, the application process. And we have an improved data storage and computing infrastructure on the Ray environment, which used to be called My Research. And we have some programming support, as I mentioned, to help you extract your approved data. There is also CTSI consultation on data use, and there is a data user group that I'll talk about in a couple of minutes. So another mechanism that you can use to access Medicare data and also Medicaid data would be the Virtual Research Data Center, which is a virtual research environment that is managed by the Centers for Medicare and Medicaid Services by the federal government. This virtual research data environment requires that you pay a fee for a seat license, basically to have an individual who can program data inside the VRDC. And then there's also a project license each year for setting up your project. For certain studies, this may be the way you want to go. The data that's in the VRDC is very timely. I think it's updated every quarter. So if you're doing a time-sensitive study, then you can get more newly released data. And if you want to have a larger sample size, like if you're studying a really rare condition, you may find that a 20% sample is not good enough and that you need access to the 100% data to get a big enough sample size for your study. So in those cases, we do have some researchers here at UCSF who have a seat license in the VRDC, and it might be possible to coordinate the program or effort so that you can split the seat cost and reduce the cost of accessing and using the data. You still might have to pay the project fee or part of a project fee to do a modification of the project to go into the seat. But if we've got a programmer in there already, it'll save you money by sharing that programmer. Plus, you already have somebody who's familiar with the data, which also will save you time. Planned for this year, probably starting, I think, the last week of March or first week of April or so, faculty, postdocs, and doctoral students are who are using Medicare data are welcome to join a user group. This is intended to provide peer support for data and analytical questions, also to provide opportunity to share ideas and get input on research ideas through a work in progress seminar, and to develop new collaborations. So if you're interested in that, you can contact Ulrich Munk at the email address here on the screen. So I mentioned the market scan claims data, and to give you a little more information about that, it is a de-identified enrollment, inpatient, outpatient, and pharmacy commercial claims data set with over 50 million covered lives in the United States. It's fully longitudinal, so you can track many patients over a long period of time. And we now have the data through 2019. So we've got 10 full years of data available now. These data are really useful for cost, utilization, and epidemiological research, and it's large enough to be representative of the full US commercial insurance population. So to access those data, as I mentioned, we have a site license for the research studies and a streamlined process for approval. We also made improvements to the data storage and computing infrastructure, and we have some programming support to help researchers make their initial cuts of the data. So another thing that the Population Health Data Initiative has done is purchased partnership as within the Berkeley Restricted Data Center. So the Berkeley Restricted Data Center provides access to dozens of governmental surveys and administrative data sets. Just to give you a screenshot of some of the data sets that they have, I'm not even going to read this whole list, but there are a lot of different data sets: census data, Bureau of Labor Statistics data, data from the National Center for Health Statistics, the National Survey on Drug Use and Health. A lot of these data sets are restricted or have a version of them that are restricted because of privacy and confidentiality issues. But for many of these data sets, you can apply to access a restricted use version of the data, and you can do so through the virtual or through the restricted data center at Berkeley. You have to go through an approval process through the agency that controls the data. And then when you go to the Berkeley Data Center, you actually have to get approval from the Census Bureau as a sworn officer of the census that you're going to protect the confidentiality of the information. The standard access fee at the Restricted Data Center is $7,500 per project per year, but because UCSF is the partner, UCSF researchers can access it for free. You still need to put in your application to the CDC or whoever owns the data set itself, and you may need to pay them a setup fee, but this is a huge cost savings for you. So to learn more, you can email Pop Health, email address is on this page, or you can do a CTSI consultation about accessing the data. So in conclusion, contact us. We are trying to improve access to population health research resources, and we are totally interested in feedback about how to maximize the usefulness of these resources to the community. And we also would love for you to email us if you have data that you think could be used by others on campus. For example, we've had people at times who were purchasing the American Hospital Association annual survey of hospitals for their own research, email us and say, hey, my grant is going to pay for me to buy the data, but I noticed that if we pay another $1,500, we can get a campus-wide license. Is there money to help pay for that extra campus-wide license? And our answer has universally been, yes, we can do that. So if you're looking at a data set and you think there might be a site license option, please reach out to us, because we have some funds to put some of these data sets into a campus license, which then makes it useful for everybody. So to acknowledge the people that we are working with now in this phase 2.0, it is a village to make this happen. Financial support has come from the EVCP office, Dan Lowenstein. We are very, very grateful for that, as well as to Dean King, who has put in resources, as well as the time and the effort of people in SomTech around all of this work. I also want to acknowledge the people who really launched this thing before my time in leading it. Claire Brindis, Bob Wachter, Julianne Sosa, and Kirsten Bibbins Domingo, who of course heads up the population health initiatives in the School of Medicine. Without this group of people, we would not be where we are today. So if you have questions, you can email the address on this slide, or you can go to the website. And I'm also happy to take questions now from anybody who is here that might have any.
I'll start. Thank you so much for that talk. That's a really incredible palette of data resources. I wondered if you had any sort of office hours. What if a researcher says, I have a question I think maybe we could answer with data, but I'm not sure how or where or how, you know?
Right.
How how do you identify which resources are appropriate for your project if you're not sure yet?
You know, I would start with just a generalized CTSI consultation. You can just put in that request and say, I'm interested in learning about data that I might use for fill in the blank study. And they're pretty good at figuring out who to field that to. If they're not sure, honestly, they like email pretty much everybody that was on that earlier slide and just ask us, like, what do you think about this? Also, if you know, a good way to learn about more data options if you're doing this kind of research is to apply to be an affiliate of the Institute for Health Policy Studies. There is a link on our website to apply for affiliation. It has some questions about, you know, why are you interested in this area of work? It's honestly a pretty low bar. You know, we're really trying to grow the family and create an environment where people who are interested in this kind of research can easily find each other and network and kick around ideas and learn more. So, you know, it's not always easy to figure out what kind of data you want to use. And I feel like every month I'm learning about a data set that I never knew even existed before. So it's a constant process. Yeah, other questions?
I guess there aren't any more, but thanks, Joanne, for coming on and providing this as a resource. We're going to make your slides and your recorded lecture available to the rest of our department.
Which is fabulous. And yeah, and I'm happy to answer questions offline if anybody wants to email. You know, there's a lot of really good resources here, and you never know when it is that you're going to hit a study where you go, oh, I think I remember this presentation. So I'm glad you recorded and are putting the slides up.
Thank you. Have a good night, everyone.
Thank you.